that we really don't talk about a lot, even in the health sector, even in the health sections of the media. So we're happy that you are here to amplify the need to talk about this issue and how we can address it, especially in the Philippines. Here in the Philippines, later our discussants here will tell the numbers. Around 500 to 1,000 birth, no, are encountering issues on clef, and we have experts here to share with you. But to officially open our discussion this morning, of course, we have Operation Smile Philippines President Donald Lee. So, sir, I'm giving you the floor.
Okay, good morning. Members of media, so good morning. I've been with Operation Smile for almost 20 years now. In 2007 yata, I was a board of trustee. Then of course, governance requires us to step down for some time, so other boards come, and then I'm back again. What really drew me to Operation Smile is a very simple advocacy. Initially, you always think that it's always healing, cleft lip, cleft palate, no. But it's really, I still remember when Bill Maggie, when I had this first conversation with him, he always reminds me that it's not physical, it's really more mental, emotional. No? It's you're really changing a life. That's why that's the initial tagline we had. We changing the lives of these kids one smile at a time. And that's the very essence of it. You realize that yung mga kids, pag may cleft lip, cleft palate, di sila lumalabas, they don't go out. They're always very ashamed, shy, embarrassed. And nakita mo naman kasi hindi mo talaga mapigilan eh. If you're face to them, titingin ka talaga eh sa cleft nila. So once you will see a tremendous transformation, no? That when they're healed, they're very proud. They're very they really feel that they can conquer the world. So we are changing one simple liability that they have, no? That they have no control of, to something na biglang they can take control of their lives. And that's why I think we're very proud through the years. No? We've been partnered even before. No? Although pati mga Miss Universe, a lot of different organizations have really partnered with us. And what is different, no? Because I've been with different advocacies. What is different is that you can change a life in less than an hour. A simple operation can. Less than an hour, biglang we just bring in the materials, the doctors, no? And that's it. No? That's a transformation already. Sabi ko if you see naman in the Philippines, maraming mga iba nagtatransform para gumanda eh. The wish of a simple child is just ayusin lang yan. No? And that's why for us it's really leveling the playing field for them. It's really ensuring that they really have a future, hindi na sila mahihiya. No? When they go out, they have an equal fighting chance. And we have enough stories to show. Chantin, mga singers, we have so many people have conquered the world. No? Kasi nakita namin yung journey nila in 40 years. The babies who we have operated on eventually became very successful professionals, no, in their craft. So with that, we really hope that you can help us push this forward. No? It was a very noble advocacy of Dr. Bill and Kathy Magee. Americans na nakita nila ang dami pala pwede gawin dito. So and again, we have them to thank for that. And again, of course, whenever we go out and we talk to people about this, laging hindi naman priority ang cleft lip, cleft palate eh. Kasi hindi naman life-threatening yan. But I always say, if you want to invest in the future of our kids, of children, no, that is, I think, one of the most worthwhile investment. Only because if you sponsor it, it really changes the life of the children. So with that, I really thank all of you for giving us this chance to really share the story. We'll share with you some hard numbers. We'll also share with you the realities, that the challenges we face. But at the same time, we're very optimistic moving this forward. Makita mo later on, we'll explain how we do our care, how we take care of the kids, all the way from start to finish, and of course, yung iba lifelong. That's why we're able to have very good relationship with most of the patients that we have. Okay? So with that, I hope that you enjoy and this is a good learning experience for all of us. Alright, some numbers nakita ko, nagulat din ako na ganun na pala, dami na nangyari. So thank you for being here.
Okay. Thank you, Sir Donald Lee, for giving that introduction to our Media Roundtable event this morning. So, Later, we'll have more discussions, of course, on the actual state of this health issue. We also have a discussion on how OS Philippines has been helping resolve this issue and improve the lives of the children and their communities. And of course, we'll also talk about partnerships. That's why our friend from Johnson & Johnson Philippines, Mickey, is here. But at this point, we'd like to show you a special message na sinut lang po, especially for you, straight from our founders in the US. 4 years ago, dito po sa Pilipinas, pinatag ang OS Philippines, particularly sa Naga. And may message yung founders natin para sa inyo. Let's watch this.
I'm Bill McGee and
Kathy McGee.
And as you probably know, Kathy and I first took a trip to Naga City in the Philippines, and that was the beginning of Operation
40 years
Smile.
ago.
40 years ago, and it just seems like yesterday, because through the children in Naga City and through their cleft lips and cleft palates Operation Smile crew, their stories resonated not only in the Philippines but around the world, which led us to be in about 30 or 40 countries actively took care of thousands and thousands and thousands of kids that never had a chance for life. Now, what is our challenge? How do we use the infrastructure that we learned was necessary in the places that we've been for the past 40 years? And how do we take that infrastructure and bring it to the next stop? How do we bring it to the next places so that excellence in care can be delivered everywhere? That's a challenge, but it's not impossible. And with your help and with what you and we have done over the years, we can set the stage for the rest of the world to make our world a safer place for surgical care.
So we're calling this love and leadership, and we feel like the Filipinos have given so much love and care, medical expertise that they've expanded all over the world and taught others how to take care of children. This cleft lip, cleft palates has been unbelievable. So here we go with our donors, with our medical teams, with our students, and our corporations. Thank you for joining us, and let's go for it. It's love and leadership for the next generation.
And there's no better place in the world to do it than to start in the Philippines. We know that from history.
Alright. So, thanks to our founders, they're in the US. But at this point, let's talk about the real issue, the heart of this discussion. So, I'm giving the floor to the Chief Medical Officer of OS Philippines, Dr. James Wakino.
Well, he's preparing. Okay, I'm just a doctor. Okay, and very few people know that we're not the most important part of the team. We do the surgery. We spend like 15, 30 minutes on hour of our time. We change the life of a child. Not only the child, the family, the community as well. It's a very powerful transformer, of a community. So people think that we're the stars. No, we are not. Just the surgeon. These are the people who are more important, because without them, we cannot be with the patient. So I think Emil will be the one to answer any questions about the surgical aspect of it. I'm very much willing to actually answer.
Yeah, okay. So, well again, good morning everybody. I'm Emiliano Romano and I'm the Executive Director for Operations Health Philippines. So thank you for being here. I will be working with Dr. James on this part of it so that we can work together. So as you know, there is worldwide actually there is an estimate of 5 million untreated cleft lip and palate patients all over the world. This is a number of a few years back, so we're not considering all the newborn. There was a survey done, at least in the Philippines. Some country may vary, but at least in the Philippines, that 1 is to 500 newborn, we get 1 child with either cleft lip or cleft palate. So you can imagine if you have a born rate like 2020 census, I think in the Philippines when we computed, there was an estimate just for 2019, there was an estimate of about 5,000 to 6,000 new children born with cleft, based on just this percentage of 1 is to 500. So imagine if you do not treat, then this number multiplies. And of course, when it comes to COVID-19 pandemic, I think like all of us here, it was a very challenging situation because our number one priority, at least for our medical practitioner, is safety. So safety is the number one rule when it comes to delivering care to our children. So this is, I would like to see this. So this is a perfect example of a patient that when you look at it like this, you think that may not need anything, but then this patient may have an open palate. Right? And so that's the reason why we are blessed by our volunteers, doctors, to really provide care, because it's not just a matter, letting the patients on a OR room and provide surgeries and changing their life. No, it's really understanding the autonomy of the patients, making sure we are dealing with children from 6-month-old up to 14, 15, 16 years old, right? So this is the variety. Usually above that age, 16, 17, usually we try to offer other services, maybe a speech bulb instead of a surgery, especially for palate. Because of course, I think for a child, palate would be the best age for surgery.
Before they learn how to speak, because there are two conditions that we treat basically with Operation Smile. Okay? The lip and the cleft palate. Okay? The lip is for aesthetics. You can see adult patients going around unrepaired, yet they survive. Okay? However, for the palate, it's for speech and for being able to eat properly without having problems of the food going into the lungs. No? So we treat the child quite early. During missions, we have found out that it's the safest age would be about 6 months to 8 months. Okay? Although in private practice, we treat it even right before they leave the hospital. Okay? But of course, Operation Smile is the vast experience of trying to do formulate best practice for how to treat this, because safety is our primary concern. Okay? Now for the palate, it's before they learn how to talk, so it's about 1 year old. Now, however, if the child is already an adult, and because of there's no available doctor in the area, we treat them up to about 18 to 21 years old. And then if those who are older, we have non-surgical ways of treating them. That's why we work with the dentist as well, and the speech therapist, who are just as important as the surgeon in giving comprehensive care for these people.
So that's what those are the three main problems which Doc James just explained. It's not just the aesthetic component, but so one thing that I think Operation Smile has been good at is what we call our global medical standards. This is our standard of care practiced by all our practitioners, like our plastic surgeon, anesthesiologists, pediatric nurses, dentists, speech therapy. And this is across all, meaning when we go into a surgery, at least for a volunteer standpoint, if they feel that the environment is not safe for the child, they rather fear the patient instead of pushing for a surgery that may cause problems. And so it's I'm always amazed about our volunteers, because they really take one case, but it's like one case at a time. This is not a number game. We really want to focus on the child, making sure that the child is safe, making sure that the child comes in the room, comes out smiling and everything. So we really take care of those people. And then of course the comprehensive cleft care. I think Operation Smile has been known for that we don't just do surgery. Surgery, we always say it's only one component of what we do. But we also do nutrition programs, we do dental, we do speech therapy. And then recently we also had the psychosocial care as well, because as we discussed a while ago, many patients of ours, they get rejected by their communities just for being a cleft patient, right? There is in some you go far area, they oh you're a cleft, they think so many stories. So we have to add the psychosocial to help their family as well. And one of the most also is that while Operation Smile is a global foundation, right? Many of these surgeries actually done in countries by medical practitioner like Dr. James. Actually, Dr. James is also our chief medical officer volunteer. So it actually supervises our entire medical component whenever.
The chief medical officer, the safety of each surgery rests on my shoulders. I'm responsible. So to assure that, okay, we need to have the right equipment. We have to need the right people there, the anesthesiologists, the nurses. Everybody has to be credentialed according to the safety standards, global safety standards of Operation Smile. So it's just so amazing. Operation Smile was born here in the Philippines. Now we go to 52 countries worldwide to even volunteer with them. We get data and experience of other countries and then we share it with one goal, safe surgery for everybody. So that's my role here in the Philippines. We keep on reviewing certain sites. We give the go signal if a mission is a go or not. And then that's a little bit of a big responsibility on my part. But as a doctor, we're used to that. Safety of the patient is always priority. And that's more fulfilling for me than doing 100 noses, rhinoplasties, or breast augmentations, which is my main practice actually.
So in the Philippines, we have about 200 to 300 what we call credential medical volunteers. I think we are, I would say, one of the strongest volunteer base among all our countries that where we are in. And as I explained a while ago, so what our medical practitioner really does, it's really help us creating the comprehensive cleft care and delivering the comprehensive cleft care. So from nutrition, speech, dental, surgery, and psychosocial. And of course, every part of this comprehensive cleft care, there is a strategic plan that these medical practitioners or volunteers put in on a weekly basis. It's like their second volunteering job, because in Operation Smile Philippines, all our volunteers are 100% volunteers. We don't pay them. They really dedicate their time to us, and that's why we're always so proud to people like Dr. James.
And we really need your help. Media, we really need your help to increase awareness that repairing a cleft child requires a team, okay? And the safety, of course, is utmost priority. We're not dependent on numbers. And I will be very proud to be in the organization that is, as of now, the only organization, I think, delivering comprehensive care from surgery to speech to nutrition to post-op, follow up the patient until they're really okay. It's not fire and forget surgery. Like we do surgery, we get paid by the PhilHealth system, and then that's it. No, we don't do that. Okay? And it's also very good that the government is helping us in this, but we really need your help to increase the awareness that this surgery involves a lot of people, and so we need to increase awareness so we can have more volunteers. Operation Smile is based on the spirit of volunteerism. I used to teach, I just retired last January. I used to teach medicine in UERM. And since I've been with Operation Smile since 1989, I've seen the transformation of the doctors before and the doctors now. No? The young doctors now,
No, they're not into
they're not into this. No? Their sense of charity is gone. No? And
They
then
want to
they just
learn
want to
first.
get rich, which
Yes.
is, I don't think that's bad, but they want to get rich fast.
That's true.
So we tell them, please review your Hippocratic oath, you're supposed to help, and the money will just come. Okay, so That's why we need your help. No? There's Operation Smile. We still need all the volunteers. If you are really truly a volunteer, you don't wait to get invited. You volunteer. Okay. Yes.
Alright.
All right.
A big hand please for Emil and the Flames.